Okay, well, we are going to get started. Again, we do have a packed agenda. We want to make sure we have plenty of time to talk to all of the amazing speakers we have gathered here this afternoon. I would like to welcome to the stage our partners from Medtronic LABS. We have Oren Umbiro, who's the Chief Medical Officer for Medtronic LABS, and Ann Stake, who's the Chief Strategy and Product Officer for Medtronic LABS. Please, round of applause for our speakers. Thank you. Great to see you both. Hope you've been having a good week here on all the UNGA festivities and that surround it. And what we want to do is talk a little bit about partnerships and digital innovation. We just finished a session earlier talking about AI and other innovations, but really drill down into the example of Sierra Leone and how you at Medtronic LABS are using these new approaches to really advance healthcare. So, Oren, I would love to start with you. Medtronic LABS is partnering with the Sierra Leone Ministry of Health to work on deploying a new model of primary care that's really data-driven, a new healthcare model. Can you tell us more about this and what is so revolutionary and new and what is working?
Great. Thank you very much. So, as you've correctly mentioned, we've been working with the government of Sierra Leone now for a few years. And we are looking at how to improve primary health care, leveraging on technology in Sierra Leone. So we know there's been a lot of buzz around primary health care and how that can be strengthened. And we see a lot of value in leveraging on technology to be able to drive that. So one is we are doing this through two approaches. So one is by participating and supporting the ministry in developing and deploying their digital health strategy. And the digital health strategy really looks at how do we deploy scalable and sustainable digital health models that can have real impact on the people of Sierra Leone. And then two, how then do we leverage on this digital health strategy and the technologies that come with that to one, improve access to care, mainly through community health services and lower level facilities. Two, to improve the quality of these services through many approaches that digital health can enable. So such as decision support tools for the community health worker, linkage to care, retention in care, and even some of the nudges to improve how clinicians prescribe medicines, how they alter those medicines and all that. And then three, how then do we leverage that to drive patient outcomes? Because that's really the North Star, so that it's not just digital health for the sake of it, but how does that, as we strengthen primary healthcare, is it having a real impact on the people of Sierra Leone that we serve? Thank you.
Thank you. And Anne, we've both been in some other events this week where I think there's been a lot of discussion around integrated primary healthcare and not looking at things just from silos and having a more integrated approach. So can you talk a little bit about your SPICE platform work and how it goes about trying to achieve this goal?
Yeah, definitely. Thank you. So we're really excited about this new phase of work in Sierra Leone that we're about to kick off. So as Oren mentioned, we've been working in Sierra Leone for about 2 years and have been able to show with our SPICE platform and our programs measurable clinical outcomes for patients in the country. And now together with the Bill and Melinda Gates Foundation, we're really working with the ministry to reimagine primary care and really break down a lot of the barriers that we've seen in the past. So there's 4 key things that really make our approach different. So really the first is all around the bidirectional linkage between community health and facilities. So oftentimes we see community health work, collecting data, reporting into DHIS2, but not being linked to the primary healthcare centers. What we're doing is really equipping community health workers with SPICE, where we can diagnose and refer patients to the nearest health center, risk stratify them, create treatment plans that then link back out to community health workers. So we're actually following up based on data. The second key area is all around integrated primary care, as you say. So really breaking down the verticals with the ministry. So really thinking about how malaria, TB, HIV, but also NCDs like mental health, hypertension, and diabetes all fit together. So we're no longer addressing clinical verticals separately. And then the third key area is all around how are we actually using data, not just collecting data. So we've seen so many digital health tools that are just collecting data or digitizing paper records and reporting. But we're working with the ministry to figure out how do we actually use that data to drive outcomes. So at the community health level, that's all about how do you decide which patients to visit when based on clinical need. At the facility, that might look like better decision making for doctors. At the Ministry of Health level, that looks like making better population health decision or policy decisions. And then the fourth component, and I know this is quite buzzwordy, but we've been working on how do we actually create machine learning and AI use cases that are actually constrained, ethical, and driven by government as well.
So you talk a bit about outcomes, and I know you really focus, particularly as a data-driven company, on clinical outcomes. So Oren, can you talk a little bit about what those outcomes are that you're tracking, what you're hoping to learn from them?
Yeah, so we look at outcomes from two perspectives. So there is one, the individual patient level outcomes, because as I said earlier, all this is to improve someone's life. And these outcomes can be a reduction in blood pressure. It really depends on the disease condition that we are addressing. Whether it's reduction in blood pressure, reduction in blood glucose, whether it's cure rate for TB, whether it's reduction, because we also look at the social determinants of health, the lifestyle, behavioral factors. So has someone stopped using tobacco? Has their BMI reduced? So that's the first layer of outcomes, which is the number one priority. The second one is health system outcomes. So health system performance, health system efficiency. And as Anna's mentioned, looking at how is digital health enabling prioritization of the highest risk patients to be visited, say, by a community health worker or to be followed up. And then two, how is the health system then leveraging on the data that is being collected through the digital platform to optimize the little resources that are available in the country to be able, say, to plan for medications, to optimize human resource capacity, and even build that capacity. So those are the two layers of outcomes we look at. And we do this continuously with the health systems that we work with. And we do this, especially in Sierra Leone, on a monthly basis with the facilities and with the regional, subnational, and national governments that we work with. Yeah, thank you.
And what potential do you see in kind of scaling this model, beyond Sierra Leone?
So Medtronic LABS, we work in about 10 countries, but our ambition is to have this sort of data-driven model approached or adopted and adapted worldwide. We're building a consortium that we announced earlier this week at CGI, all around our open source platform, but also about the approach. So it doesn't have to be just about Spice or using our technology per se, but how do we actually create digital health that delivers value to health systems, that creates measurable outcomes? I think we've all seen like the hundreds of millions of dollars pouring into digital health, and yet haven't seen a lot of return necessarily on that investment. And so we're building, partnerships with not only governments, but also bilateral donors and Africa CDC, WHO, all of the players. So invite everyone to join, and hopefully it can scale well beyond Sierra Leone and the work we're doing there.
And what recommendations would you have for other countries or organizations that are looking to scale this? And I'll start with you, Anne, and then hear from you, Oren.
I think what we've seen is that so many digital health solutions are just codifying existing services. So we see time and time again, service delivery models that maybe are so very inconvenient for patients. There might be 10 touch points that a patient has to go through to get a simple service. And then digital health companies come in, or digital health innovators come in and simply digitize what exists. And I think a push for everyone is to really rethink digital health, not make it something that just comes in and digitizes, but really aims to transform and generate health outcomes.
Oren?
Yeah, so as we move towards and embrace primary healthcare and community health services as our pathway to UHC, I know there's been a lot of discussions around, are we giving community health workers too much to do? Or are we putting too much pressure on primary healthcare facilities, given the limited resources available there? So my recommendation is the trade-off here is not to decentralize services. The trade-off, the better trade-off is to leverage on the power of technology. One, to improve how those services are offered so that we can optimize those resources at that level. And then two, to reduce things like the reporting burden on community health workers or primary healthcare facilities. And also there have been a lot of discussions around the quality of services that can be offered at that level as we do this task shifting and task sharing. So again, digital health then gives us a roadmap and a way to be able to improve the quality of care that is offered at that level through some of the digital decision support tools that technology offers. Yeah, thank you.
Well, thank you, Oren. Thank you, Anne. And thank you to Medtronic LABS for being an innovation partner with us here. If people want to learn more, I'm sure you'll be sticking around. Feel free to come find them. But thank you both. And we will continue now with the topic of global health. And I'll introduce my colleague, Catherine Cheney, to the stage. But thank you all.